We're an institution that's completely dedicated and devoted to our patients from the time that you decide to come in and see us to get the care that you need, all the way to the next generation. The beautiful thing about this practice is that we're actually treating the sons and daughters and even grandchildren of the patients who were seen here in 1948.
Because of the breadth of knowledge of 4 generations of doctors, what's handed down from generation to generation is respecting the patient, treating the patient with dignity, understanding that the patient really comes first.
I joined this group because of its reputation, because of its far-reaching ability to handle anything that comes through the doors, the skill of the people that would be my partners, and the partners have been great.
If I don't have the answer exists somewhere within this organization. And it's not unusual for me, if I have a particular problem, or if one of my partners has a problem, to call me in and get what we call a curbside consult. You know, what do you think about this? Yeah, oh, by the way, so-and-so had a similar case last month and he did it innovatively, and maybe we can build on that. So we're building on the depth and breadth of the practice, which doesn't exist anyplace else.
If I were in single practice, I really wouldn't know who to turn to ask for advice. With this group, I can probably fall back on 225 years of collective plastic surgical experience to tap into. So that not only helps me, but in the long run, it helps the patient. It's a big plus.
I'm able to work with my partners. Oftentimes they ask me to help them with certain procedures, and I ask them, and we give each other a hand. It's just a wonderful environment to work in.
The great thing about practicing at Long Island Plastic Surgical Group is that we have always been aware that we set a very high standard. And we want to be innovative, and we want to be cutting edge, but we also want to be extremely safe. And I know that I'm continually learning from my colleagues, and I hope they're continually learning from me.
First of all, we're the largest practice in the nation. Secondly, we're the oldest. And thirdly, we're the only academic freestanding practice, meaning that we have a residency program, so that we're sharing this information not only with each other, but with generations of plastic surgeons to come.
I myself trained in this residency program. When I came to the completion of my plastic surgery training, it was maybe 4 months before I was to graduate. I was approached by the Long Island Plastic Surgical Group to join their practice. It was one of the proudest days of my life.
I was a resident here at Long Island Plastic Surgical Group between '87 and '89, and so now I am one of the senior partners training residents. And Dr. DiGregorio went through the residency here, so did Dr. Simpson, and so did Dr. Rena.
We run a major teaching program in plastic surgery, so the people who have been selected to join this group over the years have had a priority of a commitment to teaching. They want to teach, they want to take care of their patients well, and they want the best outcomes they can get. Patients recognize this. They understand commitment very quickly. If your commitment is to the patient, they'll see that immediately. Plus the fact that you're teaching and you're demonstrating to students, to residents, to all levels of people who have an interest. There's a lot of respect there.
It's very interesting to realize as you go on in your career how acutely aware the patient is of everything you're doing and your presence in the room.
Intonations in your voice, questions that you ask, perceptions, little tiny things that make an enormous difference.
In our specialty, I think you develop a very intimate relationship with the patient, more so, I think, than in many other surgical specialties. Because at least in what I do, I meet most of my patients right after they're born. I play with them while I'm examining them. We sit down on the floor, and a lot of especially my cleft palate kids, I need to get speech samples from them, so we play with toys instead of having a formal examination where they're going to get quiet and not talk and get scared. We play.
Being a patient myself, all doctors have been patients. And you want to go to a doctor who's warm and compassionate and friendly and can tell a joke, and that doesn't take away the commitment and seriousness that I have with being a plastic surgeon. But I think it's comforting and also humanizing for patients to know that their doctor's he's a good guy, he's a regular guy.
I think it's as important as the actual technical skill that goes into providing the product, because you can really see when a patient builds that trust in you and builds that bond with you and you have the human connection, they just do better.